My name is Dr. Bhushan, but you can call me Dr. B. In this video, I'd like to discuss what are clinical trials. Clinical trials are research studies that involve people. Through clinical trials, doctors find new ways to improve current treatments and the quality of life for people with disease. How is a clinical trial started? Well, before any new treatment is used with people in clinical trials, researchers work for many years to understand its effects on cancer cells in the lab and in the animals. They also try to figure out that the side effect it may cause. Clinical trials are available for all stages of cancer. It's a myth that they are only for people who have advanced cancer that is not responding to treatment. What are the clinical trial logistics? Well, every trial has a person in charge, usually a doctor, who is called the principal investigator. The principal investigator prepares a plan for the trial called a protocol. The protocol explains what will be done during the trial. It also contains information that helps the doctor decide if this treatment is right for you. The protocol includes information about the reason for doing the trial, who can join the trial, called eligibility criteria, how many people are needed for the trial, any drugs or other treatments that will be given, how they will be given, the dose and how often, what medical tests will be done and how often, what type of information will be collected about the people taking part in this trial. Why are clinical trials important? Well, today, people are living longer lives from successful cancer treatments that are the results of past clinical trials. Through clinical trials, doctors determine whether new treatments are safe and effective and work better than the current treatments. Clinical trials also help us find new ways to prevent and detect cancer. And they help us improve the quality of life for people during and after treatment. When you take part in a clinical trial, you add to our knowledge about cancer and help improve cancer care for future patients. Clinical trials are the key to making progress against cancer. Let's talk about the phases of clinical trials. Well, clinical trials to test new cancer treatment involves a series of steps called phases. If a new treatment is successful in one phase, it will proceed to further testing in the next phase. During the early phases of trials, such as phase 1 and 2, researchers figure out whether a new treatment is safe, what its side effects are, and the best dose of the new treatment. They also make sure that the treatment has some benefits, such as slowing tumor growth. In the later phase, such as phase 3 trial, researchers study whether the treatment works better than the current standard therapy. They also compare the safety of the new treatment with that of the current treatments available. Phase 3 trials include large number of people to make sure that the results are valid. To recap, phase 1 trial purpose is to find a safe dose, to decide how the new treatment should be given, such as by mouth or vein, to see how the new treatment affects the human body and fights cancer. Phase 2 trial purpose is to see if the new treatment has an effect on a certain cancer, to see the new treatment affects the body and fight cancer. Phase 3 trial purpose is to compare the new treatment or new use of a treatment with the current standard treatment available. They also compare the safety of the new treatment with that of the current treatments. Let's talk about use of placebos. What are placebos? Placebos are substance that has no therapeutic effect on your cancer. Placebos are rarely used in cancer treatment, clinical trials, meaning there is never a trial done when one group is not given any treatment and compared with other group which is given treatment. They are only used when there is no standard treatment after patient has gone through every available treatment and their cancer is still worsening. Or they may be used in a clinical trial that compares standard treatment plus a placebo with standard treatment plus a new treatment. This placebo is designed to look like the medicine being tested but is not active. Using a placebo in this way can help prevent patients and the doctors from figuring out which treatment group they are assigned to. Let's talk about randomization and bias in clinical trials. Randomization, in which people are assigned to groups by chance alone, helps prevent bias. Bias occurs when a trial's results are affected by human choices or other factors not related to the treatment being tested. For example, if doctors could choose their patient to assign to which groups, some might assign healthier patients to the treatment group and sicker patients to the control group without meaning to do so. This might affect trial results. Randomization helps ensure that this does not happen. Due to randomization, you may not know which group you belong to. Are you in experimental or in standard group? Now let's talk about how to decide about taking part in a clinical trial. When you need treatment for your cancer, you may want to think about joining a clinical trial. Like all treatment options, clinical trials have possible benefits and risks. By looking closely at all options, including clinical trials, you are taking an active role in a decision that affects your life. Some of the possible benefits of joining a clinical trial could be you will have access to a new treatment that is not available to people outside the trial. The research team will watch you closely. If the treatment being studied is more effective than the standard treatment, you may be among the first one to benefit. The trial may help scientists learn more about cancer and help people in the future. What are the possible risks? The new treatment may not be better than or even as good as the standard treatment. New treatments may have side effects that the doctors do not expect or that are worse than those of the standard treatment. You may be required to make more visits to the doctor than if you were receiving standard treatment. You may have extra expenses related to these extra visits. You may need some extra time as well as uncomfortable during these tests. Even if a new treatment has benefits in some patients, it may not work for you. Health insurance may not cover all patient care costs in a trial. And you may be part of a group who gets standard treatment only and not the new treatment. Well, I hope this information helps you to understand clinical trials, their benefit and risks. If you have any other questions or comments, feel free to share them in the comments section below. It has been my pleasure to share this information with you, and I look forward to seeing you again. Exercise regularly, eat healthy, and stay fit. Dr. B signing out.